Good afternoon, everyone. I'm just going to hold off just for a little while, just to give some people enough time to join, and then we'll be starting shortly. Right. Good afternoon, everyone, and welcome to this afternoon session of PG Week. So this session is going to be about postgraduate routes into specialised health vocations, and I'm joined by Ruth Strudwick, who's going to give a presentation for the duration of this session. If you have any questions, please feel free to put them in the comments. We'll be able to see them, and if you've got time at the end, we should be able to answer some of your questions. I'll be able to put them up on the screen. So without further ado, I'll pass over to Ruth. I'll just get your presentation up, Ruth.
Thank you.
Okay, feel free to start when you're ready.
Lovely, thank you. Good afternoon, everyone. Really great to be with you this afternoon. So, as Solomon said, my name's Ruth Strudwick. I am a diagnostic radiographer by background, but I'm head of allied health professions here at the University of Suffolk. And I'm going to be talking to you a little bit about postgraduate routes into healthcare. I'm specifically looking generally at that, but also at the courses that we offer here at the University of Suffolk. So I'm going to break the presentation down into a couple of areas. The first one is to look at pre-registration master's programs that you can access to get into healthcare courses and healthcare professions. And then I'm going to talk about postgraduate courses in specialist areas of practice. So first of all, pre-registration master's programs. So these are designed specifically for students who have a first degree, perhaps in a related subject. They might have studied a science course or something else that kind of would lead them into thinking about health. And it's a fast track route into healthcare. So it's a 2-year master's course, so an MSc. And there are various courses around the country that you can do that are called pre-reg master's programs. Here at the University of Suffolk, we actually have 2 pre-reg master's programs, one in adult nursing and one in diagnostic radiography. These courses tend to be quite fast track and intensive, but they give you all the skills that you need to be a healthcare practitioner. And students who come onto these programs will have done their first degree. They're used to studying. They would have probably studied research methods and done a dissertation as part of their first degree. And so we kind of take those skills a little bit further. But the practical skills, the sort of clinical practice placements, are still the same as you would have if you were doing a healthcare course as a pre-registration undergraduate student. So we pack in all of that placement experience into the program as well. So these courses are ideal for you if you're kind of changing direction. So you might have done a first degree and not really sure what you want to do with it. Or you've thought about healthcare, but you weren't really sure what you wanted to do at the time. And so have done maybe a subject in science or psychology, sociology, those kind of things. So the students we have on these courses would have done a variety of different degrees beforehand, but they will be familiar with studying. So they come and I would say hit the ground running, learning about sort of all the things that you would have done if you did healthcare as your first degree, but really packing that in and getting the placement experience as well. So the courses that we run at the University of Suffolk, as I said, are an MSc in adult nursing and an MSc in diagnostic radiography. And both of these courses are a January intake. So we've just started our second intake of both courses, actually. So this is the second year that we've been running the courses. So our numbers are around about 20 students on each program. And those students will undertake practice placements throughout the region. So if you were doing adult nursing, you'd be placed at one of the placement hospitals used by the nursing courses. So that's within Suffolk. And then for diagnostic radiography, our students are placed over the East Anglian region, so 11 different hospitals for placements. And the course runs so that you have a block of academic and then a black block of placement. And what you're doing is learning how to do the job as well as obtaining your master's degree. So the studying is at master's level, at level 7, but the practice placement is at that level that you need in order to qualify as a radiographer or as a nurse. And at the end of the 2-year program, so in the December of the 2nd year, you will qualify and you can register either for nursing with the NMC or as a radiographer with the HCPC, and then start work the following month. So students who started in January of this year, 2025, will finish in December of 2026 and will be able to start work straight after that. So this is a fast track route into a healthcare course. Obviously, there are other healthcare professionals as well in other universities. So you can do pre-reg master's programs in pretty much any of the healthcare subjects. But as I said, here at the University of Suffolk, we have adult nursing and diagnostic radiography. So that's the pre-reg master's program. So that's one route into healthcare, particularly for people who maybe are changing careers but have a first degree and want to continue on. So the second, the thing, that you can do to kind of prepare you for that is to maybe do some work experience and visit a department, visit a hospital, visit some healthcare setting to get some experience of working with the public. Obviously, do your research, make sure that this is really what you want to do, because if you're changing careers or changing outlooks, then it's really important that you understand what you're doing. Gaining experience of working with the public in any setting is really, really helpful if you want to be a healthcare practitioner. So, working in sort of the hospitality industry or in retail, really important that you understand what the job involves. And we have open days here at the university where you can come and find out a bit more about our courses. And obviously there's information on the website as well, which you can be directed to as part of this week, looking at the different courses that we run. So moving on, our second area is postgraduate courses in specific specialist areas of practice. So I'm going to focus now on allied health particularly. So these two courses that are listed on this slide, we have a postgraduate certificate, postgraduate diploma and masters in advanced clinical practice, and this is open for all healthcare professionals. So these now are courses that somebody who is already qualified as a healthcare practitioner can do to kind of enhance their skills and to kind of accelerate their career, perhaps moving into leadership positions, thinking about working up the banding. So as a band 5 newly qualified person, you'd be then looking at how you could progress to band 6 and band 7. And then the second course listed on here is the Practice Education Postgraduate Certificate, which is for all healthcare professionals. So this is particularly geared towards people who are supervising and working with students in the practice arena, gaining some skills around teaching students in practice. And this is for all healthcare professionals. And this is the first year of a master's, if you like, a postgraduate certificate. And you can use that postgraduate certificate to what we call RPEL, so recognition of prior learning, move into continuing on to a full master's. This is quite a new course, and we started that in September. And then this slide shows the suite of the radiography provision that we currently have at the University of Suffolk. So the first few listed all the way down to the dual energy X-ray absorptometry are all postgraduate certificates in specialist subjects. So you can study that postgraduate certificate to gain more experience in a particular imaging modality or a particular area of practice. So for example, computed tomography and magnetic resonance imaging. So it might be that you're working in those areas of practice in a radiography department, and you want to upskill and learn a bit more about the theory and the practice, and you want to progress up to a higher level. Then we have the postgraduate certificate in paediatric imaging. So we have radiographers who are specialised in imaging children, and this really equips them with the skills that they might need, and talking about things like safeguarding and sort of child development, and understanding how imaging children is a really, really key part of their role. And then we have a reporting course for radiographers learning to report adult chest radiographs. So this is a developing area of practice for diagnostic radiographers where they're reporting on images, and this course will equip you with the skills that are needed for you to be compliant with what the regulations say about what experience you need in order to report on images. And then we have our postgraduate certificate in computed tomography colonography. And this is a national programme run across the whole of the UK. We work alongside the National CT Colonography Academy, where we're training people, so they're working in practice and they're learning how to do CT colonography examinations. So they're based in their own hospital, and this is a purely online course that is run by us in conjunction with the Academy, and students learn the techniques in their own hospitals. They have a trainer who comes out and works with them, and this is a qualification to enable radiographers to carry out this examination successfully, and it's part of obviously the cancer pathway in trying to detect colon cancer. And then we have a new course that will be starting in September, which is DEXA, so dual energy X-ray absorptometry. So this is a postgraduate certificate for people who want to be carrying out DEXA scanning to learn how that's done. I learn a little bit about fracture liaison service and their role in assessing for osteoporosis. So this suite of courses, our Centre of Excellence for Radiography Education Postgraduate, there are a number of programmes there. They all run through an academic year, so starting in November and running through till the summer. They're a one-year part-time programme. Students come for sessions in the university. Some of our sessions are delivered online as well, and they're spaced out throughout the year. So that students finish in the summer, and then they can use that postgraduate certificate to progress onto our master's route. So each of these PGCs are 60 credits at master's level, and will equip people to work in those specialist areas and to start working as enhanced practitioners. That's a huge selling point for you to have that qualification as an enhanced practitioner, and that's what our professional body is looking for. So the College of Radiographers are looking for radiographers to be educated to master's level, and having a PGC would kind of entitle you to be an enhanced practitioner. And then the last course that's listed is our continuation route, our progression route for anyone who's completed one of the postgrad certificates. And indeed, people can come in from other universities having completed a postgraduate certificate in a specialist area in radiography, and they can come in with that, and they can RPL that in to do our progression route. So the progression route is 2 years. So the first year is the postgraduate diploma, and then the second year would be the the master's. So the postgraduate diploma level is 2 modules, one on leadership, and it's very much looking at leadership in service innovation. And then the second module is research methods to equip you to do your dissertation, which is the final year, the master's year of the programme. So we find that these particular programs attract radiographers from practice who might be interested in furthering their knowledge of a specialist area, and they'd probably be funded by their employer to undertake the postgrad certificate. And then if they want to go on to do the full masters, completing the masters would be like the advanced level. So the College of Radiographers also recommend that those working at advanced level have a full master's qualification. So we're working towards that with our practice partners. So we've had students come onto these programs. Obviously, you need to be a qualified radiographer and be employed. So we've had students come from all over the country. We do attract students from our local area as well, but we have had students come from all over the country. The paediatric imaging course is one of 2 in the country. There are more courses in CT, MR and reporting. Obviously, the CT colonography being the national programme, we are the only provider for that. And then the DEXA course, when it's up and running, will be one of 2 in the country. So these are quite specialist areas of practice, and we've got the expertise within the team to be delivering this kind of specialist programme. And obviously, if you want to go on to do a full master's, then you can use that first year, that PGC year, to RPL into the master's programme. There's lots of information about all of our courses on the university website. So in terms of funding for these postgraduate certificates and the master's route, normally employers would fund their employees to do the postgraduate certificate and hopefully also to move on to the master's. So all the students that we've had so far through these routes have been funded by their employer. But obviously there is the opportunity to self-fund if you wanted to do that. As I said, on our website, there's lots of information about all of the courses that I've spoken about, including the pre-registration master's fast track route, but also all of our postgrad certificates and our postgraduate diploma and our masters. So please do have a look at the University of Suffolk website to get some more information about these routes. And for each of the courses, also you'll find information about our course leaders, and they're the best person to contact. But if you can't find their details, you can also contact me, and I will pass you on to the relevant person. So our course leaders will be able to help you with things like the dates that the course is running, how much the modules cost, content of the modules, which you can also find on the website, but you can kind of ask a few more questions around that. So delivery dates are really important in terms of fitting them in with your work, because most people who do these postgraduate certificates and this master's route will be working full time, either within the NHS or within private practice in an imaging department. So they need to be able to organise their time around their work and making sure that they have the time commitment. I think it's really important to think about, do you have the time to do this, setting aside time to study. So for me, the main things that I would say really are, think about what it is you want to do. Do your research. That's so very important. If you're able to get some work experience in a particular area of practice to find out what the job is all about, that would be amazing. And certainly if you're thinking about the pre-reg master's routes, do find out exactly what it involves and what the job is all about. And the things that you can use to sell yourself are obviously having some experience of working in healthcare, but also working with the public in general and dealing with different ages of people. And then with our postgraduate courses, just think about what it is you want to do. Will your employer fund you and help you and support you? And doing a master's level qualification equips you with the skills to be a leader, to do research, to think about service innovation, to improve the experience for your service users and for your patients, and also to become a more well-rounded practitioner. So that's kind of the summary of what I was going to cover this afternoon, and I'm more than happy to take questions if there are any at this stage. Thank you very much for listening.
Thanks, Ruth. So we have had a couple of questions, so I'm going to put one on the screen. This one, there are some parts which we won't be able to answer, so I'll just need to signpost the student somewhere. But there may be some parts which we would be able to. So when can we start applying towards the next year course? And for international students in the UK, can we apply from the UK, or do we have to go back to our country to apply? Should probably take it by that first bit first. So when it comes to the international aspect, if you reach out to our international team, they'll be able to help you with those specific aspects. If you reach out to international at uos.ac.uk, we also have a international specific session taking place tomorrow afternoon from 2 till 4. So that will cover most of the things you need to know about kind of applying as an international student. And we also have a panel with some international students in the afternoon at 3 o'clock. So I'd recommend coming back tomorrow for that. But the first aspect, when can we start applying towards the next year course? Are you able to answer that, Ruth?
Yeah, so for the pre-reg master's programme, so that's the 2-year accelerated course that if you've got a first degree for, you can start applying now. And the next programme will be January 2026. So we're already taking applications for those courses. So that's for adult nursing or diagnostic radiography. So you can already apply for those. In terms of being an international student for these courses as well, we do take them on those 2 courses. So just to be kind of upfront with you, we do take international students on both our pre-reg MSc programs, so you can apply. And as Solomon said, that you can get all those answers to the questions by going to the international team here, but also attending that session or watching the recording. Placement fees are part of the course fees, so there's no additional cost there. That they are a part of the initial fees as an international student.
Great, thank you. Then we've got one more from Nadine. Jump on the screen. One question: can allied health professionals work as a trainer in the NHS?
Yeah, so one of the courses that I talked about that we have is a postgraduate certificate in practice education for healthcare professionals, and that's for all healthcare professionals, including allied health and nursing, midwifery, and medics. They can come and do a postgraduate certificate with us in teaching, practical training. So yes, you can work then doing training in the NHS. So, for example, we have people who are practice educators who work with students in practice. We have people who train in specific areas, so things like basic life support, moving and handling. But that course will be really helpful for you in terms of learning how to teach and what the theory behind teaching is, and some of the sort of skills that you might need to be a practice educator. So that would be a helpful course for you. But yes, you can work and you can train others, and that's kind of an extension of your role.
Great. Thank you, Ruth. I'm just going to double check that we haven't got any more comments through any other platforms. Doesn't look like it at the moment. But if people do have any questions after the stream, are you okay for them to email you? Are you able to?
Yes, of course. Yes, of course. So my email address is just r.strudwick@uos.ac.uk. So my first initial, then my surname, and then @uos.ac.uk.
Perfect. Thank you. Oh, just had one more come through. Let's put this up. MSc Public Health and Wellbeing is offering in September intake 2025.
I think it is. It's not in my area of the university, so you probably want to check the university website to find that information out. But yes, there definitely is an MSc in Public Health, and I think it is for September. Yeah.
Perfect.
But do check that out on the website just to be sure.
Yeah. All right, thank you. So if you join us again at 4 o'clock this afternoon, we have another session where we'll be discussing postgraduate career prospects and just kind of different aspects of postgraduate education with a number of academics, including Ruth herself as well. So I think that's all for this stream, but I'll see you this afternoon if you're going to attend that one. All right, thank you.
Thank you.